pharmacy residency really prepares you above and beyond what you get in your undergrad and graduate training for your doctoral degree, with more hands-on application of how to manage patients in different health systems. And here at FMRI, because we get such a diverse group of patients with many underlying disease states and chronic disease states, we offer a residency program that really meets that need, which would allow the residents after the program to go out and pretty much set up a program of ongoing care anywhere in the country that they would desire to go. So the resident has ample access to refugee patients, patients with coexisting diseases of HIV and hepatitis C, in addition to their access to chronic disease management in the areas of heart failure, diabetes, hypertension, respiratory disorders as well. FMRI has 7 clinics in the Treasure Valley. The pharmacy resident primarily interacts with 2 of those clinics, which is our Emerald Clinic, which has the HIV and the hepatitis C, and then traditional ambulatory care clinics. And then also in our Raymond Clinic, the resident participates in ambulatory care, which constitutes, chronic management of patients with heart failure, diabetes, respiratory disease, and then the community-associated infections and things that walk in. But also we have a longitudinal experience, which is in our specialty clinics, which include dermatology and then rheumatology, that the resident staffs once every other week with our specialists coming in.
I thought FMRI, when I was doing my research for pharmacy residency programs, had a really unique program. In terms of patient population, they're very different. We work with a lot of refugee patients, HIV patients, underserved patients, even transgender patients, and that's not something I was commonly seeing in other programs.
We have a mission to serve the underserved, so many of our patients are without insurance and without established health care, and we help establish that health care for the patients. So the pharmacy resident then incorporates in, they do a lot of education of patients who really have not been established with the healthcare system.
This is a very unique residency, so we spend a lot of time in the ambulatory care setting. There is a community pharmacy component to it, so I do staff a community pharmacy or a retail pharmacy here, which is also a different type of pharmacy than most community pharmacies. It's a 340B, so that means it's federally qualified. So again, you get that different experience, which is really nice because you get to implement your knowledge from the clinic into the community pharmacy and vice versa.
Well, I've been here 33 years and I love coming to work every day, primarily because of the fact that it is an organization that is committed to health education. We have learners in every imaginable health discipline, from medical assistants all the way up to physicians and fellows, and pharmacy is in the middle, and our job is truly to provide drug information and medication education to each of those providers and to the patients. It's totally an inclusive environment. The residents are a very social group. They incorporate the pharmacy resident into their activities during the day and then also after hours as well.
I feel like everyone should be able to get optimal health care and be able to take control of their health. So being in this type of facility really feels rewarding. So every day I feel like I have either helped someone, I've learned something, I leave here really happy. Like, I call my parents all the time and I'm like, I'm really happy leaving work today. Like, it's really a great experience, and it's really important to me to be able to help these people who want to take control of their health. It's really nice to be in this kind of environment.